that into my brain as we speak.
All right, and it's uploading right now to YouTube, and then, all right, Sonia. All right, and we will be recording now. And Sonia. We're good to go, guys.
All right. Are we open?
Yes.
We're good. You are live.
Great. Okay. Sonia, you ready?
Yes, Senator, you can go ahead with the script.
Okay. Welcome. I am Senator Tom Sherman from District 24. I'm chair of Senate Health and Human Services Committee. Today we will be hearing various bills and conducting the executive session on those bills. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with right to know law. As chair of the Health and Human Services Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12 pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that number one, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom and YouTube software here for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through the platform. And the public has access to contemporaneously watch or listen to the meeting on Zoom and YouTube and via telephone by following the directions and links provided on the General Court website. Number two, we have provided public notice of necessary information for accessing the meeting in the Senate calendar. Number three, we are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email. Sonia, do you have the email?
Yes, it's remotesenate@leg.state.nh.us.
Can we do that one more time?
remotesenate@leg.state.nh.us.
Or call, and the number is
271-3043.
That's 603-271-3043. In the event the public is unable to access the meeting, it will be adjourned and rescheduled. Number five, please note that all votes taken during this meeting shall be done by roll call vote. And number six, finally, let's start the meeting by taking roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. And Sonia, will you call the roll? Or do you want Monica to do that?
I think you can do that, actually.
Oh, awesome. All right. So I am chair. I'm Senator Tom Sherman, and I am in Rye, New Hampshire, and I am alone except for my dog. Senator Bradley.
Good morning, everyone. I'm here.
Where's here?
Oh, Wolfboro, in my home.
And are you alone?
Yes.
Senator Fuller Clark.
Good morning, everyone. I am in York, Maine, and I am alone.
Let's see, Senator Chanley.
Good morning. This is Shannon Chandley. I am at home in Amherst, New Hampshire. I'm alone in the room right now, but it is possible that my husband or son may wander through.
Senator Gray.
Senator Gray, I am in Rochester at my home, and I'm alone in the room.
Okay. And Senator Gray, just a technical note, if you start having trouble with your audio, you can he drop his video, or is he not allowed to do that? Sonia. But sometimes if on Zoom, if you drop your video, your audio improves. Just a technical
That's
note.
fine.
Okay. All right. So we are going to go ahead and get started with our agenda. I don't have a gavel, so I'll use my fist. We are opening the hearing on HB 1264, extending the commission on the Seacoast Cancer Cluster and recognizing the bill sponsor, Representative Muse.
Thank you, members of the committee. Thank you also to Senator Sherman and Senator Bradley for the work that you've done in consolidating some excellent legislation. HB 1264 attempts to address a complex and tragic public health problem that was with us long before the pandemic and that will likely be with us very long after the last person is vaccinated in COVID-19 as a memory. Although the original bill has been amended to include some additional extremely important legislation regarding PFAS contamination, I'm going to confine my remarks this morning to the extension of the Seacoast Cancer Cluster. Since 2017, the Commission has been looking into the occurrence of two very rare and very specific forms of cancer that are showing up in communities, especially in children, along the New Hampshire seacoast. One is a rare and highly malignant form of cancer known as RMS, or rhabdomyosarcoma. I hope I'm pronouncing it right. And this cancer has led to several deaths of children in the area surrounding Coakley landfill. The vast majority of these cases are occurring in children under the age of 18, which makes them even more tragic. The state has also identified higher than normal pediatric lung cancer cases involving another rare cancer called pleuropulmonary blastoma. I think the most important thing that the investigation has revealed so far is that there are no easy answers or quick solutions to this problem. Having attended some of the meetings of the commission, one of the things that becomes apparent to you very quickly is there's an incredible amount of information to digest, and it's continually coming at you from multiple sources, not only sources here within the state of New Hampshire, but also researchers across the country who are looking into the impacts of these diseases and starting to draw some conclusive connections between PFAS and some of the problems that we're noticing here in New Hampshire. So the bottom line is that that a situation like this doesn't necessarily respect our legislative deadlines, and the commission needs additional time to do its work. And what this bill would do is extend the work of the commission through June 30th of 2022, with 3 interim reports delivered along the way. I would ask that you approve it, and I'd also ask that you listen very closely and give careful consideration to the newer elements of this bill that have been added to it as well. Thank you.
Thank you, Representative Muse. Are there any questions for the representative? If I could, Sonia, I'd just like to say a couple of words about the bill. This is Senator Sherman speaking. Since the cancer cluster was identified now over 5 years ago, almost 6 years ago, this has been a major focus of my work. I was chair of the governor's task force on the Seacoast Cancer Cluster. And then when the bill moved into that, into the House, I've been on that commission ever since. And this work is voluminous. The amount of effort that's been put in by the stakeholders, including Representative Muse, Representative Mesmer, Representative Cushing, and Representative Edgar, and there's a long list, Representative Malloy, and Senator Fuller Clark, has been enormous. The work, unfortunately, though, is far from done. So I'd ask for everyone's support on this very important bill. And Sonia, if we can move through to the next person on the list.
Yes, so the next person we have signed up to speak is Representative Cushing.
Good morning, Rennie.
Good morning, Senator, members of the committee. For the record, I'm Representative Rennie Cushing from Rockingham District 21, the town of Hampton, and I'm here to support the bill itself. I'm a co-sponsor of the bill to extend the life of the Seacoast Cancer Commission, and also for the underlying Sherman-Bradley amendment. And I too want to echo what Representative Muse said and express my appreciation for Dr. Sherman and for Senator Bradley for cobbling together these important and related pieces of legislation. I just want to go on record in supporting that. I'll come back and talk to the amendment if you like, but and I commend the committee for having this public hearing. Thank you.
Thank you, Representative Cushing. Are there any questions for Representative Cushing? Seeing none, next.
The next person I have that signed up is Jason Randall, but I'm not seeing Jason on the list. Jason, if you are listening, if you're calling in from a phone, could you virtually raise your hand to help me identify you?
And Sonia, I think they can do that on the phone by hitting #9, I believe. You can raise
Thank you.
your hand.
Okay.
We don't have. Let's keep an eye out for Jason.
So Senator Sherman, he was the last person I had signed up to speak on the bill itself.
Okay.
I do see that Mindy Mesmer has a hand raised.
Does she want to speak to the bill or to the?
Let's find out.
Okay.
I've just unmuted her.
Good morning,
Mindy,
sorry.
Did you want to speak to the bill or the amendment?
Both, actually.
Okay.
Are they both being heard right now?
Yes.
Okay.
Well, we're going to hear that as soon as we're done on the testimony for the bill, we will shift to the amendment, and then you could speak on both if you wanted, or you can speak individually on them.
I'll speak individually. I did, by the way, sign up twice to sign up to speak. So I don't know what happened, but just to let you know, there
That's
may be a
fine.
glitch in the system. So I am, for the record, I am Mindy Mesmer, former state representative from Rye and Newcastle, and an environmental and public health scientist, and have been a part of this investigation since the beginning with Senator Sherman and Representative Cushing and other representatives, and Senator Martha Fuller Clark. We have, as Senator Sherman and David Muse have talked about, not finished our work by any stretch of the imagination. It is a very complicated issue. We do have high rates of cancer in our children in the seacoast of New Hampshire. We also have, I believe, elevated rates of adult cancers in the same area, which require further investigation. We have really focused a lot on a big Superfund site that has impacted and threatens to impact the drinking water of 5 towns around the Superfund site called Coakley Landfill, which has been the focus primarily of the task force, but there are other environmental factors which could be contributing that we have not gotten to yet. Also still very concerned about what's happening with respect to the Coakley Landfill. There was a House bill passed last year that required action, a plan and then action by September of this year. which has basically just kicked the can. The state agencies have kicked the can down the road on this, and we are not seeing the action that's required to address this important environmental threat to our drinking water and environment on the seacoast. So I think that I ask the committee to support this bill. It's a very important bill for the seacoast residents to continue to look for and address environmental contributors to cancers on the seacoast. And we'll speak to the amendment once we get to that point. But thank you very much this morning for having this hearing.
Thank you, Representative Mesmer. Any questions for her? All right, let's move on to the hearing on the amendment. Well,
Actually, Senator, I think we have Jason Randall now.
okay.
I just have to find his phone number.
Good morning, Senator Sherman and the committee. This is Jason Randall.
Thank you for joining us, Jason. If you could state where you're from.
Sure. Jason Randall, Plymouth Village Water and Sewer District, Plymouth, New Hampshire. I'm the superintendent for both water and sewer in Plymouth.
Okay,
And
Jason,
I'd just like to,
did you want to speak to the bill or to the amendment?
I'd like to speak primarily to the amendment.
Okay, why don't you go ahead since you're on now, and we had trouble finding you. We don't want to lose you. So go ahead.
Sure, I appreciate that. Thank you very much. So as I stated, I am the water and sewer superintendent for Plymouth, New Hampshire. And this amendment to House Bill 1264 came to my attention regarding PFAS contamination. There's a few comments I'd like to make in particular to the amendment. Would you like to hear those now or in written testimony or both?
If you could, you can speak briefly now. If you could, if you could go ahead and submit written testimony, that'd be great. So generally, we ask for you to hit on the highlights of your testimony, what you want us to remember verbally, and then the written testimony is more involved. That'd be great.
Sure. I think I applaud the committee for taking PFAS on. This is a challenging topic, as you know. There are a few considerations that I'd like to point out. The beginning of the amendment, I believe it's in H1, lays out the cost of remediating this contamination for many communities would result in dramatically higher water and sewer rates for end users. That is something that I agree with, but that the amount that it would result in dramatically high water and sewer rates, the amount that's in the bill of $50 million, I don't believe covers the sewer portion of the contamination. I believe that the figure that was carried for the drinking water portion only, and that I believe that amount is less than what DES actually estimates for the total cost to remediate the contamination. So I would ask that the committee please review that amount, that number, and consider both wastewater, sewer, and residuals as well in the amount of remediation funding required. The second part is the responsible party piece. I think that needs to be defined in the document. It does go on to mention municipal immunity based on RSA 507B:9. And I believe we need some clarity regarding those two pieces of the bill. And then if you go down in H4, to my knowledge, there's no currently proven or cost-effective technology to treat wastewater effluent and residuals. So I would ask that the state engage engineers and economists and consultants to determine the most cost-effective solutions for groundwater, surface water, and aquatic life protection. Is it something that the legislator would be interested in commissioning a study for the statewide remediation prior to setting the limits in statute? I think that's definitely something that needs to be considered. Down in H10.6, the capital appropriation piece, it mentions drinking water sources and wastewater residuals, but does not mention wastewater effluent as part of those appropriations, which is not consistent with the intent of the bill, I believe. Another consideration, other than capital appropriations, is the ongoing operation and maintenance of treatment systems that may far outweigh the cost of the capital costs for these systems. So that's something that also needs to be considered, is the operation and maintenance of these systems long term, for the long term sustainability for treatment. Overall, I think it's a step in the right direction. Thank you again for the group for pointing, bringing this to our attention, but we definitely need to consider all the costs and benefits of this bill. Thank you very much. I'll take any questions. Thank you.
Thank you. I have a question. You said you're from Plymouth, is that correct?
Correct.
Yeah. So first of all, I wanted to say thank you for that, for all of that. I really would appreciate written testimony because I couldn't write fast enough to get those specific points.
Sure, not a problem.
Does Plymouth actually have a PFAS problem in their waste system?
Yes, that is currently my understanding.
Okay, thank you. Any other questions from the committee? Seeing none, thank you for your testimony. Senator Bradley, would you please introduce the amendment? This is 1261S.
Good morning, everybody. Let me first start out, if I could, by thanking all the staff, Sonia, Monica, Tricia, Alan, Josh, Bobby, and Shannon.
You wrote that down, didn't you?
I did. Who really, I have to say, have done an unbelievable job of walking somebody like me through the process so that we can all have this hearing. I just think it's important to thank all of you who've worked hard to make this happen. I have some more thank yous to add on to your thank you, Senator Sherman, regarding the amendment and the hard work that's gone on for several years regarding PFAS. Obviously, yourself as the sponsor, Senator Sherman, of Senate Bill 287, Senator Waters sponsoring Senate Bill 496, and Senator Morse, who worked together with Senator Waters and many others to actually write the text of the bill, starting the amendment starting on section 4. This is a result of the Governor Sununu's leadership in establishing the standards that we see in section 3 of the amendment, Senator Sherman's bill, with the hard work of DES and many people at DES. This amendment builds upon the work that was established in Senator Innes's bill a couple of years ago, that Senator Feltz, myself, Senator Fuller Clark, Representative Hinch, and others worked to get across the finish line. And lastly, while I'm doing the thank yous, I think it's important to thank Barbara Reed of the New Hampshire Municipal Association, as well as the Office of the State Treasurer. So what the amendment does, it puts into law the limitations on PFOAs that were established by the department. And it also, starting in section 4, has a funding mechanism to help mitigate the impact that Mr. Randall talked about for end users. The one thing I would say in answer to Mr. Randall's question is that this legislation and the underlying DES rules have not set a standard for wastewater yet. So until that standard is set, there is nothing at this point in time to remediate. So I believe and hope that after the hard work of DES, Senator Moore, Senator Waters, and others, that the $50 million bond will at least cover the initial few years of implementing these standards. There is the hope, the thought, and the legal action that potentially responsible parties in a settlement or through litigation will assist with the cost of remediation of New Hampshire's groundwater. Obviously, that remains to be seen what happens. But if you look on page 3 of the amendment, starting on line 17, which is where the contingent reimbursement comes in. So much of the loans that would go out to communities hopefully will be forgiven through this process. That's what's envisioned. It obviously will be a long-term opportunity, if you will, by the state of New Hampshire to be able to, through this bond and through the legal actions anticipated, be able to mitigate the cost to local water and sewer users. So I think, Senator Sherman, I'll stop there. Happy to try to answer any questions, and we'll go from there.
Thank you, Senator Bradley. Do any of the committee members have any questions for Senator Bradley at this point? I would like to add that one more thank you. I don't think Senator Bradley had this in his list of thank yous, but as a result of the bill that Senator Bradley cited and the work of Representative Mesmer and others, the department was able to hire a toxicologist named Dr. Ali. And the work, the numbers that were released by DES as to set the MCLs and the numbers that were then incorporated into 287, which was my bill in January, which passed the Senate 24-0, were numbers that are based in science. And I very much appreciate Dr. Ali putting together that package. I would like to thank our Department of Environmental Services for their work on this, as well as Dr. Ali. I have had emails that have asked, where did those numbers come from? And not only did they come from science and from a scientist within the Department of Health, Department of Environmental Services, but it's my understanding that New Jersey is adopting similar levels. So I think what we're finding is the science is telling us what we thought the science would tell us. And that's that we need to tighten the standards. One other point that I'd like to make is that one other email concern is that we're putting standards into statute. And I would remind people who are emailing that we have many standards in statute, MCLs. We have arsenic, we have lead, and others. So with that, Sonia, who is next on the list?
Next on the list is Representative Cushing.
Representative Cushing, we've missed you.
I've missed you too, Doctor. It's been quite a while since we had a chance to Zoom together.
There we go.
Anyways, thank you very much. And again, I'm Representative Rennie Cushing from Rockingham District 21, and I want to commend the Senate for cobbling together these pieces of legislation. SB 287 does contain the MCLs, and you share my understanding that New Jersey just the day before yesterday, day before, recently adopted similar standards, as New Hampshire has done. I would note that House Bill 1603, which is on its way over someplace, also, kind of parallels the Senate bill that's here, and that we attempted to put kind of a lockbox on any proceeds that would come from litigation around, responsible parties for PFAS, to make sure that it goes to remediating the problem and it doesn't end up in the general fund, which we thought that was prudent. Again, I commend the Senate for this. I would note, as we move forward with adopting the MCLs contained in the drinking water, there's a companion bill that I hope doesn't get lost, and that is House Bill 1274, which is the Safe Bottled Drinking Water Act. What it does is it ensures that the MCLs that we establish through Senate Bill 287 or through this bill for public drinking water are also consistent with the standards for bottled drinking water that's sold on the stores of in grocery stores. It seems that when we set out as a matter of public policy that there are certain maximum contaminant levels we want for everybody who drinks water from the tap, there should be an assumption that we'd have the same standards for water that comes through the in bottles that we buy on the store. This would address that. And with that, I just, again, I'm completely supportive of this, and thank you.
Thank you, Representative Cushing. Any questions from the committee for Representative Cushing? Seeing none. Thank you, Sonia.
Okay, next we have Mindy Mesmer.
Representative Mesmer, if you could introduce yourself.
Thank you. Thanks again. This is Mindy Mesmer, environmental and public health scientist from Rye, New Hampshire, former representative for Newcastle and Rye, and want to speak in support of this very important amendment to the bill. I'm so happy that, thank you, Dr. Sherman, Senator Sherman, and Senator Bradley for putting this together and making sure that this doesn't get lost in the process. This is a very important piece of legislation that I fully support. It is important to make sure that Mr. Randall spoke about the cost-benefit analysis, that we also include in our cost-benefit analysis the cost to public health, which is sometimes not included in this type of analysis. And as we know, or many people know, the state of New Hampshire has very high rates of cancers, not just the pediatric cancer cluster on the seacoast, but as a whole. New Hampshire has some of the highest rates, if not the highest rates, of various cancers in the country. And we must do whatever we can do to reduce the rates and prevent cancer in our state. Not only do we have the highest rates of pediatric cancer in the nation, but we have the highest rates of bladder, breast, and esophageal cancer in the nation. And also we are number 9 for brain cancer in the nation. So we really must do whatever we can to prevent cancer. And this is a step in that direction, in making sure that we write into statute these very important drinking water MCLs that were established based on science, based on a perfect, very thorough analysis done by Jonathan Alley, Dr. Alley of the Department of Environmental Services, and the state and the governor have acted in support of those important levels on it to protect our drinking water. So I'd like to say that I fully support it. Hope that you can pass this through and have the governor sign it and save the state some money in our courts. Thank you very much.
Thank you. Are there any questions for Representative Mesmer? Seeing none, Sonia.
Okay. Next, we have David Creer.
Good morning. Thank you, everyone, for letting me speak this morning in these very weird circumstances. For the record, my name is David Creer. I am Director of Public Policy for the Business and Industry Association of New Hampshire. Today, I'm going to speak against the amendment, specifically just the one part, the very beginning part of the amendment. So So basically, as you are all aware, these MCLs were set into rules by DES last summer. Then they were enjoined from enforcement due to a lawsuit. And the reason being that there was just an insufficient cost-benefit analysis conducted by DES that would justify the large costs associated with these MCLs. They were unable to quantify the benefits that would come from setting the MCLs this low. BIA thinks that in this time in particular, when the economy is taking such a huge hit, it wouldn't be prudent to give the people and the businesses of the state these large costs associated with these standards without knowing or without justifying exactly what kind of health benefits they would get from that. So we ask that you do not add these MCLs into statute until DES at least has the opportunity to complete the cost benefit analysis, quantifying the health benefits that would come, and let that lawsuit continue on through the Supreme Court where it now sits. I'm happy to take any questions. That was the basis of my testimony today.
Thank you for your testimony. Are there any questions for Mr. Creer? Thank you, sir.
Great, thank you very much.
Sonia.
Next, we have Sabrina Dunlap.
Good morning, Sabrina.
Hi, good morning, committee members. I'm Sabrina Dunlap, Director of Government Relations at Anthem. Thank you for the opportunity to testify on this challenging issue. I will be brief. Consistent with Anthem's comments at the hearing on SB 623 before Senate Commerce and post-hearing communications with its members, we appreciate the opportunity to raise our concerns specific to sections 9 and 10 of the amendments to HB 1264. Excuse me. These would add new sections to RSA 415 requiring insurance coverage of these tests. So with 623, we raised the question of whether these blood tests have clinical value, and we've since verified the tests do not have any clinical use and that they can't be used by doctors to guide treatment, nor can they be used to make a diagnosis. And that's based on info from both New Hampshire DHHS and the CDC. So Anthem understands the public concern that generated the legislation, but for these reasons, we oppose the amendments to 1264 related to insurance coverage. And I will submit written testimony with this info in more detail via email as well. So thanks very much.
If I could ask a question, Sabrina, it's semi would you believe, but I'd love to hear Anthem's response. I have ulcerative colitis is one of the illnesses that was identified by the C8 study as being associated with PFAS exposure. I have a patient from PEAS who has ulcerative colitis, had baseline levels drawn back when they were first looking at the PEAS well issue, and his levels were quite high. As a clinician, first of all, it's really quite critical. I would take exception to your testimony. It's quite critical that that we get a baseline level in patients with an associated illness who've had documented exposure, just like any other illness where we know there's a potential known exposure. But I cannot get a repeat level to see if he has cleared this and assess the possible impact on his ulcerative colitis. Wouldn't Anthem find that as a clinically justifiable use of having these levels, and the fact that they're not available actually impedes my ability to both treat and assess this patient and other patients who report clinical exposure to PFAS?
Well, thank you for the question. As you know, I am not a doctor, but I will say in looking at what New Hampshire DHHS has to say on the issue and the CDC, they both say that these tests are quite limited, that they can't tell you where or how you're exposed to PFAS. They can't be used to guide treatment decisions, and that they can't be used to pinpoint a health problem. So I don't know how to speak directly to your specific example, and happy to follow up with you on that. But I'm basing our position on what's available from DHHS and CDC on the limitations of these blood tests to actually be used in diagnosis and treatment.
Right. Well, thank you for that. I would point the committee to the ATSDR and some of their conclusions, which do support, which is a national organization, and it does support some of these monitoring systems, and monitoring would include blood levels. So thank you very much for your testimony. Any other questions for Ms. Dunlap? Seeing none, thank you. Sonia?
Thank you.
Okay, next we have Catherine Cole.
Ms. Cole?
Hi, good morning. Can you hear me?
Mm-hmm.
Okay, wonderful. Good morning. My name is Catherine Cole, and I am representing Tufts Health Freedom Plan. And I am here to respectfully oppose the PFAS PFC blood testing language in the amendment under consideration. I wanted to speak in regards to mandating this coverage for this blood testing to echo Ms. Dunlap's concern. We're concerned that this language mandates coverage for a test that yields results that have very limited or no clinical utility. As Ms. Dunlap did, I will point to the New Hampshire DHHS and CDC guidelines around this that state that a PFAS blood test can't tell you where or how you're exposed to PFAS, tell you what health problems might occur as a result of the exposure, or be used by a doctor to guide treatment decisions. Currently, there are no treatments to reduce levels of PFAS or PFC in the body, and thus blood testing results are not helpful in the clinical management. I also wanted to note that I'm sure my colleagues from the other carriers will bring up, it is worth noting that the House Health and Human Services and Elderly Affairs Committee voted 19-0 inexpedient to legislate on a bill that would mandate PFAS testing program for pregnant women for these reasons. So again, I just wanted to respectfully oppose this particular language, and I thank you for your consideration and time, and I'm happy to answer any questions.
Thank you. I have a question for you.
Sure.
The CDC has made hepatitis C testing a recommendation for all of us old people, over baby boomers, essentially. And so as a liver doctor, what I'm seeing is patients come in with positive hepatitis C test. We almost never know where they got that infection. Are you saying that the only blood tests that Tufts Health Freedom Plan should cover are those that identify the source of infection or contamination?
No, absolutely not. I was just citing what the New Hampshire Department of Health and Human Services had stated as limitations on this type of testing. So I'm not making a blanket statement. I'm just speaking to this specific issue.
Okay, and just a follow-up question on those DHHS guidelines. Do you know when those were made? The science on PFAS exposure is changing almost as rapidly as the science on COVID. Do you have an idea when those were actually set?
No, Senator, I don't know when those were put together.
I believe it was a year or more ago. So thank you for your testimony. Any other questions for Ms. Cole? Thank you very much.
Thank you for your time.
Sonia?
Okay. Next, we have Shayla Connolly.
Ms. Connolly?
Good morning. Thank you. It's Sheila Connolly, and I am in Holderness this morning.
Beautiful part of the state.
It is. We're enjoying our sheltering at home still, with our families, but my company continues to be considered an essential service, and we have stayed open and fully employed throughout this whole event. And I think it's important work that we do, serving our wastewater treatment plants and recycling their biosolids as a fertilizer throughout New Hampshire.
Which company are you with, Ms. Connolly?
I'm the president of a company called Resource Management, Inc., RMI. We've been in business for 25 years, and we recycle all of the biosolids from several municipalities throughout the state, including Nashua, Plymouth, Dover, Durham, all of the Lakes region through the Winnipesaukee River Basin program. So that's Laconia, Tilton, Franklin, so forth. So we have been very active in this conversation over PFAS as it relates to our concerns about continued beneficial use of biosolids on farms and in topsoil manufacturing programs throughout the state. So if I may, I would like to speak to certainly my approach here is to continue to support the study commission and for its good work on the point source impacts in the Seacoast. This has been a very important endeavor, and we hope it will continue and get an extension. I do have to say, though, that I do not support the amendment that has been proposed. I respectfully disagree with Senator Sherman and Bradley on this relative to specifically the component in the early section, which establishes the new low limits for PFAS through statute, rather than continuing to go through the adoption process in DES. As you are well aware, the process by which DES has to establish rules is to include a cost-benefit analysis. And we believe that that component of the rulemaking back in June of 2019 was not done adequately, and it should still be done. I feel strongly that by the legislature proposing those standards as originally published by DES, it has become a bit of a political component in an election year. And I don't believe that the legislature is doing a service to the state of New Hampshire, given that you charged DES with doing that process, and DES did not do that process. And now it feels a little bit like an end run. It doesn't feel like it is in the best interest of the state of New Hampshire, especially when we look at the amount of money that is potentially going to be spent on trying to comply with those limits. And I would respectfully differ on the comments about it being perfect science that led to those limits as proposed. It was anything but perfect science. And there are several places that have taken exception to this approach, including the studies that were used to support that. So I guess I just need to be on record suggesting that we slow this down, we don't adopt these standards through statute, and that we instead potentially look at how that money could be spent on programs that impact our water and wastewater infrastructure. That is an incredibly important part of clean water for groundwater, for surface water, and for residuals management. And so with that, I will take any questions. And I thank you very much for your time and service in trying to continue the legislative process through Zoom. That's awesome.
Thank you for your testimony. Are there any questions from the committee? Seeing none. Sonia?
I don't have anyone else on my list.
Okay.
Um,
And the, I'm sorry.
Senator, I see a hand raised.
Okay.
Senator Peter Bragdon.
Hi, can you hear me?
Yep.
Yes.
Okay, good. Thank you. I had registered to speak in opposition to the amendment. I'm not sure why I didn't show up on the list, but I'm glad there's a little hand raising icon there, so I clicked that immediately. So thank you, Mr. Chairman, members of the committee. My name is Peter Bragdon, here representing Harvard Pilgrim Healthcare, the state's largest not-for-profit health insurance service. And here to speak in opposition to sections 9 through 14 of the amendment, the part that has to do with requiring insurance coverage for PFAS and PFC blood tests. Harvard Pilgrim Healthcare understands the legitimate public concern over PFAS, especially the Seacoast area and the towns surrounding Merrimack, a district I used to represent, obviously. I note that a majority of the committee actually is from these affected areas. Despite this legitimate public concern, Harvard Pilgrim is concerned about mandatory coverage for a very expensive test. They're about $800 a piece, that does not yield information that can be used, given the latest evidence-based guidance, in the treatment of an individual. Earlier, Mr. Chairman, you mentioned the ATSDR, the Agency for Toxic Substances and Disease Registry. And according to them, the PFAS blood tests can be useful when they're part of a controlled scientific population study. But as far as individual testing is concerned, and here's a quote, it is unclear what the results mean in terms of possible health effects. The blood test will not provide information to pinpoint a health problem, nor will it provide information for treatment. The blood test will not predict or rule out the development of future health problems related to PFAS exposure. End of quote. Harvard Pilgrim covers a variety of diagnostic and screening tests used to guide treatment decisions. But we feel at a time when health insurance premiums are becoming less and less affordable, we should not be increasing rates further in order to mandate testing that does not guide treatment decisions. Thank you for the opportunity to present Harvard Pilgrim's perspective. I'd be happy to answer any questions, though I am fearful of getting involved in a medical debate with Dr. Sherman. But
I don't mean to instill fear. Thank you, Peter, for your testimony. Any questions for the senator? Seeing none, I really appreciate you coming by today. Thank you.
Thank you.
Sonia, are there any other members of the public who would like to speak on the amendment? Any hands raised, Sonia?
No hands raised.
All right, we will close the public hearing on the bill and the amendment, and it is currently 8:57, so we can go directly into the next hearing, correct?
Yes.
Okay. We are going to open the hearing on HB 578 and recognize the bill's prime sponsor, Representative Stringham.
Yes, thank you, Mr. Chairman. And thank you, esteemed senators. HB 578, I'm pleased to offer on the to the Senate. HB 578 started as a problem with the developmentally disabled and their transition from childhood support to adult support. This system led to some developmentally disabled prolonging high school in order to maintain benefits, which is counter to our values of self-reliance and was also financially foolhardy. HB 578 was a bipartisan bill, started with a young inspiration from a wonderful young man named Mason, who was looking at job loss and a substantial gap in services. Based on the work of the developmentally disabled community, Health and Human Services, and the House Subcommittee on Health, Education, and Welfare, there were substantial changes to this bill made, and leading after a year and a half from original filing to the current form of the bill, which passed on the consent calendar, which included many important changes additionally to support the original claims and also access federal funds. I understand that this bill will change with the amendment, but I'm still proud to lay it in front of you for your consideration and to make the best use of. Thank you very much. If you have any questions, I'd be happy to answer them.
Thank you, Representative. Any questions from the committee? Seeing none, thank you very much. Sonia?
Next, we have Doug McNutt.
Good morning, Doug.
Morning, Senator. Can you hear me?
Yep.
Oh, good. This is kind of newfangled technology for me. Basically, I'm here primarily to support the inclusion of what was Senate Bill 715 into the amendment to House Bill 578. And I'm not going to go through the substantive parts of it, but just to say that this committee had already reviewed that and voted at a committee with a vote of 5-0, and then Senate Finance also voted it out on a vote of 5-0. So we think it's something that's been vetted very well, and we're happy to see it included in the amendment to 578. The one thing I would say is that the times we're in only make this more important, and I would be happy to answer any questions. I don't know, maybe we're not even talking about the amendment right now, so perhaps I'm out of order here. I apologize if I am.
Please don't worry about it. Does anyone on the committee have any questions for Mr. McNutt? Seeing none, thank you very much.
Thank you.
Do we have any other speakers on the bill itself?
We do. We have Sarah Aiken.
Good morning, Sarah. If you could.
Good morning. Can everyone hear me okay?
Yep.
Okay, excellent. So for the record, my name is Sarah Aiken. I'm the Director of Public Affairs for Community Bridges, one of the 10 area agencies that provides community supports for people with developmental disabilities and acquired brain disorders. I'm only speaking to the bill as it is in front of you, not the amendment. I just want to give folks a quick reminder. House Bill 578 was retained in 2019. The current version that you have before you has not had a public hearing until this morning. The rationale for the bill was to give students who graduate or exit the school system a right and entitlement to adult Medicaid funded area agency services regardless of their age. And just to be clear, that has been solved. The representative who put forward this piece of legislation did his due diligence, and that bill, as it was originally introduced, has been solved through rules in conjunction with the department, who did an exceptional job bringing those rules forward. But now this bill seeks to create a new entitlement that students who are in school full-time also have the right and entitlement to adult Medicaid funded services through their area agency. I would ask that you read the fiscal note on Senate Bill 714 because these bills are identical, and take a look at the vast financial consequences of going down this path. As most of you probably know, federal law mandates that students receive special education services through age 21 in their school system. And so by offering both services, it's very duplicative and doesn't really solve any problems that the area agencies are aware of. The bill amends RSA 171A, which has worked extremely well for the past 13 years. This is a fundamental bedrock piece of legislation for the area agencies to build a foundation on, and to change it in this particular way is just something we are very much opposed to. And I'll just wrap up by saying, in 2007, the New Hampshire legislature nearly unanimously adopted Senate Bill 138, which required the area agencies and the state of New Hampshire to serve and provide full funding for the DD and ABD wait lists. This bill would make it almost impossible for that to continue to happen in the future. So I'd just like you to consider that. I'm absolutely open to any questions that you have. And I want to reiterate what a previous caller said. Thank you so much for being back and doing the good work that you do. We appreciate it.
Thank you, Sarah. I had a quick question. Senate Bill, it's 714, I believe, which was, the
Yes.
original wording was identical to 578.
Mhm.
And in finance, they amended it to create a committee or a commission to study the issue. But it sounds like that's probably not even necessary, because it sounds like things are going okay. The original problem that was presented by Representative Stringham has been taken care of in rules, and the concern about the current wording of 578 or the pre-finance finance committee wording of 714 would raise some serious potential fiscal concerns. Do we need that committee or commission at this point, in your opinion?
In my opinion, no, sir.
Thank you. All
Thank
right.
you.
Any other questions from the committee? Okay, seeing none. Thank you so much for your testimony. Sonia, is there anyone else to speak on HB 578?
I don't have anyone else on my list.
Are there any other members of the public in attendance who want to speak on the underlying bill?
I do see a hand. Oh, the hand went away.
Okay. Senator Fuller Clark, would you, do I have to close the hearing on the bill? Okay.
Yes.
So I am going to close the hearing on the underlying bill 578 and then open the hearing on amendment 1277S. Senator Fuller Clark, would you introduce your amendment?
Yes, thank you very much, Senator Sherman. And I'm pleased to be able to introduce the amendment. And what this amendment does is to establish a committee to study the safety of residents and employees in long-term care facilities relative to cost control in long-term care. I just want to say that certainly as a result of COVID, this committee to study the safety of residents and employees could not be more important. And I would urge everyone to move forward in supporting this amendment. The amendment basically establishes the committee, it establishes the membership, it outlines the duties, which include the following: to study the safety, including the risk of suicide of residents and employees in long-term care facilities. And the committee may solicit information from any person or entity. I do believe that perhaps if you, we looked at perhaps amending the amendment, that there ought to be references to the impact of COVID and its impact on both residents and the staff of these various long-term care facilities. But it's not essential that that happens, but I hope that the testimony would at least reflect the need for the commission in light of what we've experienced in the last 3 months. So happy to answer any additional questions or take commentary from the rest of the committee with regard to this amendment.
Thank you, Senator Fuller Clark. Would you be open to a committee amendment that would look at the impact of COVID on senior residential facilities under study with this committee that would address issues of PPE, infection control, human resource and staffing, and testing for infectious diseases that might be impacting the facility? Would that cover your concerns about for a committee amendment?
It certainly would.
Okay, maybe we can wordsmith that during an executive session. Are there any questions for Senator Fuller Clark?
I just like to add that this amendment respects the intent of the original bill. but just formulates it in a slightly different way.
Thank you. Sonia, who else do we have on?
Next, we have Senator Rosenwald.
Senator Rosenwald, welcome. Is she muted?
Good morning. I
There-
think I'm unmuted now. For the record, I'm Cindy Rosenwald, and I have the honor to represent Senate District 13, which is most of Nashua. And I'd like to speak to sections 6 through 8 of this amendment, because this is the subject matter that was originally contained in Senate Bill 715. These sections remove the cap on home and community-based care for New Hampshire residents in the Medicaid long-term care waiver program known as Choices for Independence. And specifically, it removes Roman numeral 2 of 151E:11, which caps the home and mid-level care relative to nursing homes. This language is designed to help New Hampshire's elders age in place. And this is really what the majority of our residents want. We've had, since 1998, New Hampshire has had cost caps on home and community-based care. But at the same time, we've developed a very solid community infrastructure for services. And while this is the policy committee, I do want to talk about the fiscal impact for a minute. Federal law prevents home and community-based care from costing more than nursing home care. And in New Hampshire, community-based care is quite efficient. If you read the fiscal note on the original Senate Bill 715, almost all of the individuals who are in the Choices for Independence program, the cost for their care plans are below 69% of the average cost of a nursing home. In fact, there are only 17 people in the state whose cost is more than 80% of nursing homes. I don't believe this language will affect the counties because we already in the budget cap their cost for long-term care. So if there were any possible cost, it would be a responsibility of the general fund. And I really believe we're talking about a very small number of people who could be affected. At the same time, on the other end, the department would be relieved of the burden of evaluating these cases to see if the commissioner would grant a waiver. So I think in the end, it could be a wash. And as Mr. McNutt said, the original Senate Bill 715 came out of your committee 5-0, ought to pass. It was on the consent calendar back in the winter, went to finance and was reported out of finance 5-0, ought to pass. So I hope he will adopt these sections. I think it's consistent with what people in New Hampshire want, and it's fiscally responsible. And I thank you very much for the opportunity to testify.
Thank you, Senator Rosenwald. Any questions for the senator? Seeing none, Sonia?
Next, we have Catherine Horgan.
Ms. Horgan?
Good morning, members of the committee, and thank you for giving us this opportunity to speak. Again, my name is Kate Horgan, and I represent the New Hampshire Association of Counties. The counties do have concerns about the amendment, specifically sections 7 and 8. As Senator Rosenwald just mentioned, the counties are responsible for the long-term care of payments of the non-federal share. Section 8 changes the way that the rates are set for long-term care in CFI, which could dramatically raise costs for the counties. While the cap still remains in place, we have not met the cap in several years. So it will increase costs, specifically around the process for reviewing any costs exceeding 80% of the average annual cost for services for a person in a nursing facility, and we would recommend that you reestablish that provision. Also, Section 7 refers to a report being given to the State and County Finance Commission. As far as we are aware, no one is appointed to this commission, and it has not met for over 5 years. So we don't think that that is the best place for reporting to go to. The NHAC believes that this is a piecemeal approach and there needs to be a more complete review. I'm happy to answer any questions that you all have this morning, but we think this just needs some tweaking and some more thoughtful approach before moving forward.
Thank you for your testimony. Any questions from the committee? Thank you. Sonia?
Senator, I did have Doug McNutt on this list as well, but did he already speak to the amendment, or should we check in with him again?
Let's check in to make sure that has no additional. Hello again, Doug. Did you have anything more?
Yes, I would, Senator. Thank you very much. I apologize that earlier I didn't introduce myself. I'm Doug McNutt from AARP. I'm our advocacy director. I would like to respond to a couple of things that Kate Horgan just said. At the hearing, if you recall, in front of your committee, there was no one who testified in opposition to the bill, including everyone from nursing homes to home care, every single group. There was no one in opposition. The counties did raise some concerns, but even at that point testified in favor of the first part of the bill in terms of reducing caps on home care. I think that the notion that they would somehow spend more money presumes that they would not save any money if people were not in nursing homes and were in home care. I mean, based on Senator Rosenwald's testimony, you'd have to believe that if some people ended up in home care versus nursing home care, that there would actually be some savings. So I don't believe if more people are in home care, it'll raise costs. I think logically it would be the opposite, or at least I would argue that it is. And I also think in terms of the current environment where we are, this, as I said earlier, is even more important. And I would take this opportunity to testify in favor of your comments, Senator, with regard to changing the first part of the bill with regard to the study of long-term care facilities. I think that would be entirely appropriate, and we would support that. And I would be happy to answer any questions the committee might have.
Thank you. Any questions from the committee for Mr. McNutt? Seeing none, thank you. All right. Anyone else on the list? Sonia?
Senator Kate Horgan has her hand raised.
Okay. Ms. Horgan.
Thank you. Just to be clear, at the original committee, the association took no position on the bill, but did raise these same concerns that I raised today. So just to be clear, it's not that we're opposed to the intent of the bill. We just think that there is a better, more complete way to do this. So thank you.
Thank you very much. All right, Sonia, are there any other members of the public who would like to speak?
I am not seeing any hands raised.
Okay. With that, we will close the hearing on Amendment 1277S. All right, do I have a motion to go into executive session?
I'll move that.
So moved.
Senator Bradley moves and Senator Fuller Clark seconds. All in favor? I guess we have to do a roll call, don't we, on any votes? Okay.
Yes.
Sonia, could you call a roll? Or are you doing that, or is Monica doing that?
I think we.
Oh, I'm doing that. Sorry. Okay. I vote in favor. Senator Fuller Clark.
I vote in favor of executive session.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray.
Yes.
All right, we are in executive session. Do I have a motion on, let's see, I guess we need to open the hearing, open the executive session on HB 1264. And I'm sorry, just a second. 1264 and Sonia, do I open 1264 and then go to the amendment?
Yep.
So we need a motion on 1264 ought to pass.
So I'll move amendment 1261 ought to pass.
Do I have a second?
Second.
Okay. Monica, are you getting these down or do I need to repeat them? Okay. Do we have discussion on 1261S?
I would just say, this is Jeb Bradley, that I think we're all aware there are significant costs. The governor is committed to trying to do everything that we can as a state to hold potentially liable parties responsible for those costs. The $50 million appropriation bond that Senator Morse and Senator Waters worked on really is a good start toward making sure that we're mitigating the impact on local communities' water and sewer rates. Given the testimony that Representative Mesmer and you yourself, Senator Sherman, talked about the health issues, I think that while the costs are clear, the need is clear, and it's for that reason that I support this amendment and urge that we vote for it.
Thank you, Senator Bradley. Any other discussion? Senator Fuller Clark.
Yes, I too want to urge support of this amendment and to thank all the various parties, especially Senator Morse and Senator Waters, for coming up with a solution to many of the concerns that were initially expressed with regard to moving forward the MCLs. I would like to just point out that this is a beginning, and we recognize that as time goes forward, there will need to be additional legislation that deals with such things as wastewater treatment, that revisits the issue of dollars available as we begin to see the impact and as we begin to see what is happening at the federal level and what is happening in other states. So, excuse me, this is just a beginning, and I would hope that the committee would join me in supporting the amendment put forth by Senator Bradley and Senator Sherman. Thank you.
Thank you, Senator Fuller Clark. Any other comments? I would just like to add that this is critical, and we've heard some testimony saying, let's wait to hear what happens in the litigation regarding the MCLs. Unfortunately, while we wait, people are continuing to be exposed. This is a process. It will take time to get these MCLs in place. And some of this type of litigation has taken not months, not years, but actually over a decade to be to reach resolution. And typically, every one of these types of lawsuits have ended up either in a settlement in favor of the tighter controls or an outright judgment in favor of the controls. So using the precautionary principle of public health, where our understanding is that we want to mitigate the risk to the public, understanding that this process could take years, and finally, understanding that if the science changes, there is built in to the amendment the ability for the Department of Environmental Services to actually adjust the MCL. I would urge passage of this very critical amendment. Senator Fuller Clark.
I do have a follow-up. I remember that Representative Cushing talked about the bottled water bill.
Yeah.
And it would be my understanding that that bill will be available to be resubmitted in the next session, that it will not just disappear. But it seemed that needed its own pathway forward and was not appropriate to incorporate into this amendment at this time. Is that correct?
That's my understanding as well.
Thank you.
All right, seeing no further discussion, we have a motion which has been seconded. I will call the roll. Let's see, Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yeah.
and I vote yes. The amendment passes 5-0. Do we need to vote on the bill as amended?
Ought to
Yes.
pass as amended.
Second.
Monica, are you caught up?
Yes.
Okay, Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yeah.
and I vote yes. So the bill moves, ought to pass as amended. Who would like to take this out? Senator Bradley?
You know what? I think given Senator Fuller Clark's announcement, she should get the honor of taking it out if she wants to.
I'm happy to take it out. Thank you, Senator Bradley.
Thank you, Senator
I'll
Bradley.
speak to it. I'm sure you will too, Tom.
Yep, sure will. So Senator Fuller Clark will take that out. And it will not be on consent. All right. So do I have a motion on Amendment 1261S? Moving on. Do we need to do the bill first?
Yes.
Okay. So we need a motion of ought to pass on 578.
So moved.
Senator Chanley moves and I'll second. And then on the amendment is 1261. No,
1277.
I'm sorry, 1277. Thank you. Do we have a ought to pass on 1277?
So moved.
And a
Second.
second? Okay. And I would like to offer a committee amendment on this that could read, in light of the COVID-19 pandemic and its impact on New Hampshire's long-term care facilities, the committee will also study acquisition and inventory of PPE in the facilities, their policies on infection control, adequacy of staffing and human resource support, adequacy of testing capacity, and support and communication with federal and state government agencies. The only one, oh, sorry. I don't know how to turn off my notifications, so I apologize for that. The only additional one that I was thinking to put into that would be the financial impact on the facilities of the pandemic. Some of these facilities are having such a hard time that they may not survive fiscally. So I would look to the guidance of the committee of whether they would want that included, since this is really primarily on safety, not on the financial aspects of long-term care facilities. Any thoughts? Senator Fuller Clark.
Senator Sherman, my only concern with adding that is that that is a huge task unto itself. And it seems to me that it might be able to prevent getting the information that we need in a timely fashion. So I have some concerns about adding the financial analysis. Perhaps there's another way to get that information.
All right. That was my leaning. That's why I left it out. But is there any other comment on my idea for a committee amendment? Is everybody in support of that? Do we need a formal vote on the committee amendment? Sonia or Monica?
Yes, but I also, can you, if that's the language you're using exactly, I need you to send that to me because I missed the beginning.
Yep, I can do that.
Could
Did everybody get that language? Senator Fuller Clark.
I think it would just be important to make sure that we all have that language.
Yep, I can do that. So can we vote on the, can I have a motion on the, or actually I introduced it, so I'll move this committee amendment.
And I'll second it.
Any further discussion on the committee amendment? Okay, so Senator Fuller, Senator Chanley, did you want to say something?
That's okay. I just wanted to hear it again. Do you mind reading it one more time, just so I'm clear?
Yeah, sure. In light of the COVID-19 pandemic and its impact on New Hampshire long-term care facilities, the committee will also study acquisition and inventory of personal protective equipment, policies on infection control, staffing and human resource concerns. Let me see, I had one more thing in here. Adequacy of testing and support and communication from federal and state government agencies.
I just have a question.
Yes, sir.
I'm assuming that that language is going to go after the word facilities on line 9 of Amendment 1277. Is that correct?
Let me just get into the amendment again. Line 9. My thought was more, it was under duties in line 18 after the word facilities.
Okay, all right, that's fine too. Doesn't matter.
That was my assumption.
Yep, okay, I'm good.
All right. Any other comments on the committee amendment to the bill?
So to confirm, line 19.
Did we say 19 or 18?
It's actually 19.
19.
Yeah, once you get into double digits, I start having trouble. Just kidding. That was...
The duties language ends on line 19 in my copy of the amendment. So I believe that that's where it would be added.
Actually, I think it should go after the word facilities in line 18 because the last sentence is the committee may solicit information. That's more of a generic. So I think it should go.
Jeb, you're correct.
I think it should go after the word facilities in line 18.
Yeah, that's where I think I had originally thought it would go. So that's good. All right, let's do a roll call. Senator Fuller Clark, this is on the committee amendment to the amendment.
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Now, on the amendment, is there any further discussion on the amendment as amended? Okay, and we have a motion and a second. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Now we have ought to pass as amended.
So moved.
Did we, and do we have a second?
Second.
I'll second it.
Senator Chanley seconds. Any further discussion? Calling the roll. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Who would like to take this out?
I would.
Okay, Senator Fuller Clark is going to be busy. And is this any interest? We're not doing this on consent, or are we?
No.
Not on consent. Everybody's shaking their heads. All right. Is there, the only other business for today is that we have, Alan, is this correct, that we have a hearing on Thursday morning at 8 a.m.?
Correct.
Correct. And for that one,
June 4th.
June 4th.
Yes, Senator.
8 a.m.
And is that going to be the telemed bill?
Yep.
Okay. Hey, I also want to give a shout out to Griffin. I missed him. If I missed any other staff that's on the phone call, I apologize.
Grisha.
But you guys have all done a great job.
Yeah, it's been amazing. Thank you so much. And Alan and everybody. Is there any other business for the committee
I
today?
just wanted to speak at the tremendous sort of preparation that was provided that assured that this meeting this morning went very, very smoothly. And I think it's a terrific example of the kind of work that we're able to accomplish in spite of not being able to meet in person. So I'd like to thank everybody involved.
Thank you, Senator Fuller Clark. I would like to just speak for 2 seconds. A former chair of Health and Human Services sits among us who will not be coming back and not running again. And I think we all are very excited for Senator Fuller Clark, but I, for one, I'll just speak for myself. As I told her, I am crushed, but I completely get it. So I know it's going to happen many, many times. People are going to thank you for your service. I want to personally thank you for your mentorship and your service. Thank you.
Thank you. I will miss all of you.
Oh, you're not going very far.
But I don't go away until December.
All right, any other business for the committee? Thank you, everyone. With that, we will close the hearings today and go back to.
Tom, can I just raise a question? Did we move to go out of executive session?
Oh, good point. No, we didn't.
I move that we go out of executive session.
Senator Bradley?
Yes,
Second
I.
Okay, so we have a move and a second. Senator Fuller Clark,
Yes.
Senator Chanley,
Yes.
Senator Bradley,
Yes.
Senator Gray,
Yes.
and I vote yes. Do we need a motion to end the hearing? We don't, do we?
No.
Okay,
You're good now.
I'm hitting my gavel. We're ending the hearing. Thank you, everyone.
See you soon.
Yeah. Bye-bye.